Hi, guys. Today we're going to talk about if your eye doctor can tell if you're pregnant just by looking at your eyes during an eye exam. Now, this is the funny eye guy, Dr. Eric. I'm an optometrist, but I'm also an amateur stand up comedian called Divorced Asian Dad. Now, before we get started, let me go ahead and answer the big question in this video. That is whether or not your eye doctor can diagnose pregnancy just by looking at your eyes, during an eye exam. The short answer is no. Now, you've got to see your doctor or other qualified healthcare providers for that. However, pregnancy can cause some changes to the eyes that you might want to be aware of. And I've got a funny story to share with you about that. So, I saw this patient, let's call her Becky. I had seen Becky over the years for eye exams for her contact lenses and eyeglasses, and it was largely routine. Until one day, Becky came in mainly because her contact lenses were bothering her. Now, she's been wearing the same brand for years, so it was a little curious. After the exam, I looked at the results and found a few irregularities. So I talked to her about the results of her tests, and I had a crazy thought that occurred to me. I advised her to talk to her medical doctor because she might be pregnant. She looked at me like I'm crazy. I acknowledged it, but I told her to think about it and get it checked out. So it was just a theory. Again, it's definitely not a standard practice for optometrists to diagnose or suggest pregnancy. But based on her eye changes and some other non-eye related symptoms she had told me about, I had just a little bit of a hunch that might be what's going on. And in a less doctory tone, I thought I'd be honest and share my hunch. So fast forward 2 weeks later, my receptionist walked into my office and said that Becky came in and wanted to talk to me. At that point, I was thinking about a million other things and forgot about what I said to her. Thinking that it wasn't a serious issue, I met her at the front desk. She was waiting for me there and she had tears in her eyes. I immediately had a sinking feeling. Suddenly, she looked me straight in the eyes and said, "I'm pregnant." My office manager looked at me accusingly. My staff stopped me in their tracks, and all the people in the reception area looked at me, including a priest who was making a sign of the cross. I was so surprised by the situation that I just stared at her blankly for a second, trying to think, why on earth was she telling me this? I shook my head, and that's when I recalled what I said to her 2 weeks ago. Then, out of panic and embarrassment, I said, "Folks, I didn't do it. I just told her to see her medical doctor to confirm that she and her husband was pregnant." The priest made a sign of the cross again, for some reason. Everyone relaxed, and I quickly brought her into an empty exam room to talk it over. So, for those of you laughing at my pain, you're welcome. I'm glad to give you a good laugh. So, why did I share my guess that she might be pregnant and risk looking like a fool? So, let's dive in. Now, there are certain physiological and hormonal changes that happen during pregnancy that can potentially affect your eyes. Now, one caveat before we begin. Keep in mind these changes that they are specific to pregnancy, and a lot of the other conditions can cause similar symptoms. So do not, and I repeat, do not go to your optometrist or eye doctor to diagnose pregnancy. Just keep in mind as a wow, that's interesting kind of factoid, So there are quite a few, but I'm only going to discuss the most common ones here. Number 1, corneal changes. Now, the cornea is the clear tissue at the front of the eye that helps you to focus light rays so you can see clearly. The curvature of the cornea could affect how you see as well as your contacts and glasses prescription. Now, pregnancy can cause hormonal shifts. Guys can relate to those hormonal hurricanes that they have to face when their lady is pregnant. Now, hormonal shifts can potentially alter the thickness and curvature of the cornea. So, for some patients, even though their contact lenses and eyeglasses have been stable for years, their prescription changes drastically and they might complain that their contact lenses aren't fitting right. Number 2, eye pressure. Now, eye pressure is one of those things that we monitor during the routine eye exam, and basically we're testing for glaucoma. which is associated with increase in eye pressure. Now, pregnancy, on the other hand, can alter eye pressure and lower it artificially. So, if a patient's pressure is rock steady for years, but then gets noticeably lower, pregnancy is one of those possible causes. Keep in mind, though, for any cause of eye pressure changes, it helps to have any previous measurements to compare it to, which is one of the reasons why routine eye exams are important as a basis of comparison before any changes or any eye diseases occur. Number 3, dry eye. Pregnancy can cause a reduction in tear production like it's the Sahara Desert, which leads to dry eyes due to hormonal changes during pregnancy. Some pregnant women come in because their contact lenses are getting uncomfortable. Now, there are other changes that can happen, during pregnancy, some of which are rare and can be serious, and this is beyond the scope of this video, but the symptoms that I talked to you about are probably the most common ones. So remember, these eye changes aren't diagnostic tests for pregnancy, okay? So, one thing I'm never going to say to my patient is, here's your eyeglass prescription, and by the way, you're pregnant. He's a boy, his name is Angus, and he's going to be a really good guitar player someday. Folks, that was an AC/DC joke, okay? The band, that is, for those of you who know AC/DC, So first of all, because these eye changes aren't specific to pregnancy, other health or eye conditions can cause them. Second, individual results may vary, meaning that the timing of the eye changes during pregnancy as well as the severity can vary wildly from woman to woman, just like women vomit constantly from morning sickness, while other women might just have like a mild nausea. So everyone is different. So, eye changes aren't reliable as an indicator to pregnancy. Instead, they're just pregnancy side effects. Now, another inconvenience that some pregnant women may have to deal with. So, sorry, ladies. So, I hope my story, with the details changed to protect the innocent, gave you a laugh. But ultimately, this is just for general information purposes. If you think you're pregnant or if you have any concerns that something just isn't right, see your doctor to find out what it is. Don't procrastinate. So guys, if you like this video, give it a like and subscribe, and watch out for my next video. Are there eye parasites living in my eyes right now? Or this video coming up? See you later.